Tracheostomy tubes are placed in a tracheostomy in order to keep it open to facilitate breathing. Inside of the outer trach tube is another smaller tube called an inner cannula. The inner cannula is removable and usually disposable. However, in order to dispose of the inner cannula, you must first have a new one on hand, and sometimes this is not the case. In these instances, the inner cannula must be cleaned and replaced in the patient's trach tube. This process ensures the patency of the trach tube and limits the risk of developing any obstruction. This video will demonstrate the process of cleaning the inner cannula of a tracheostomy tube. At Trinity Health Livonia, only supplies for the Shiley Flex tracheostomy tube are stocked, so when a patient arrives that has a different make or model of tracheostomy tube, additional inner cannulas may only be available if the patient is able to bring their own supply. Trach care must still be completed, but because we don't have the supplies to replace the inner cannula with a new one, we will instead need to clean the existing inner cannula regularly. If your patient has a supply of inner cannulas, you will be able to replace the cannula, so stop watching this video and instead watch Tracheostomy Care, replacing the inner cannula. But if you do not have additional inner cannulas available, continue watching this video. You may have noticed that on many disposable inner cannula packages, it explicitly states not to clean the inner cannula, and that they are disposable. When the appropriate supply is present, this is always the case, but if we don't have new inner cannulas, exceptions have to be made for the patient's safety. If a tracheostomy tube does not have an inner cannula in place, it could lead to some serious issues with the patient's trach tube, like obstructions that cannot be cleared. If we don't remove and clean the inner cannula regularly, it can lead to the same obstructive issues. So for these reasons, the inner cannula must be removed, cleaned, and put back in these cases. You may ask why these trach tubes aren't exchanged for the Shiley Flex when the patients are admitted to Trinity Health Livonia. This can also lead to issues, primarily with discharge. If the patient's trach tube is replaced with our Shiley Flex, we will not be able to convert them back to their original trach tube before discharge, as we don't carry it. So they will need to arrange for it to be exchanged back, or set up supply for their new device. This can delay discharge. If the patient is from another facility that only carries supplies for the patient's original trach tube, that facility may not accept the patient back with the Shiley Flex in place, which can also delay discharge. However, if the patient experiences any breathing-related emergencies, the trach tube will likely be changed to a Shiley Flex, possibly at bedside, and for this reason, a Shiley Flex tracheostomy tube kit that includes an outer cannula, inner cannula, and obturator must be available at bedside at all times. It will have to be the closest comparable size, or often the next size smaller than the trach tube that is currently in place. At Trinity Health Livonia, both respiratory therapists and registered nurses are able to clean the inner cannula of a tracheostomy tube. When should the inner cannula be cleaned? This process should be completed at least once per shift, and best practice is to clean them as close to every 12 hours as can be accommodated. An easy way to achieve this is for the nurse to clean the cannula during their assessment at the beginning of the shift. For most patients, it is advisable to perform suctioning prior to cleaning the inner cannula. This limits secretions in the airway, and also limits the risk of those secretions spewing from the tracheostomy if the patient coughs during trach care. This process is explained in a separate video entitled Tracheostomy Care, Oxygenation, and Suctioning. Begin by examining the tracheostomy tube. If you already identified that this is not a Shiley Flex, there are a multitude of different trach tubes you may see, but these days almost all varieties are plastic with disposable inner cannulas, and they all function basically the same. But make sure that you can identify the inner cannula and how to release it. Some may simply pull out, and others may have wings that you need to pinch, or any number of other simple locking mechanisms. Now, examine the trach ties and determine if they will need to be replaced. Trach ties only need to be replaced if they are wet or soiled. Before you begin the process, you will need some supplies. Most, if not all of these supplies may already be at the bedside because they are included in a list of required bedside supplies for all trach patients. This list is explained in the video Tracheostomy Care, Equipment, and Oxygenation. If you use supplies from the room, make sure to replace them as soon as possible after you are done. Like any other time you interact with a tracheostomy, you will need gloves, a face mask, and eye protection. You will also need a tracheostomy care kit, which should be available at the bedside, but if not, is also available in every pod room. Sterile water will likely already be in the room, but if not, can be removed from the Pyxis. Open the trach care kit. This kit holds a collection of sterile supplies. This procedure is not considered sterile at Trinity Health Livonia, so it does not require strict sterile technique. However, always do your best to ensure the cleanliness of your supplies. So for this procedure, we will practice a high-level aseptic technique that utilizes some aspects of sterile technique. Remove and apply the sterile gloves. The next item is a sterile drape. Open the drape to create a sterile field at the bedside table. Now set up your supplies for this procedure. Remove the brush and the cotton-tipped applicators. The twill tape will not be used. It is for securing the tracheostomy tube, and we utilize trach ties for that purpose, so you can dispose of the twill tape. Separate the split gauze from the 4x4 gauze and place them on the sterile field. Now, take your sterile water and pour it into one of the sections of the now empty tray. Once sterile water has been opened, it is only good for 24 hours, so if you open a new container, time and date it. If the container is already open, check the date to ensure that it is still usable. Go to the patient. Loosen the trach collar, but don't remove it fully. Secure the trach tube by holding it in place with one hand on the flange, and with your other hand, grasp the end of the inner cannula. Release it using whatever locking system that tube utilizes, and gently pull the inner cannula out. Do not dispose of the inner cannula. Take the inner cannula to your trach care tray. You will need to clean it, but while cleaning it, make sure only to touch the outer end of the cannula. Never touch the part of the tube that will be inserted into the trach tube. Rinse the cannula in sterile water. Take the wire brush and insert it into the tube from the outer end where you were holding. Thoroughly clean the tube with the brush. Rinse the cannula again and dry it off by shaking off excess water, and then use sterile 4x4s to dry the tube. Again, do not touch the tube with your hands, only the sterile gauze. Return to the patient. Secure the tracheostomy tube with one hand while gently inserting the cannula back into the tracheostomy tube. The inner cannula is now cleaned and back in place, but there is additional trach care that must be done at this time. Remove the split gauze by gently sliding it out from under the flange. Inspect the gauze for secretions. Inspect the patient's ostomy for any redness, swelling, bleeding, or large amounts of drainage. If any of this is noted, consider a consult for the wound ostomy team. Wet the first cotton applicator in the sterile water and begin to clean the stoma. Do the same with the second applicator. If necessary, you can use some sterile 4x4s to continue to clean this area or the flange of the tracheostomy tube. If the trach ties need to be replaced, perform this step now. This process is explained in a separate video entitled Tracheostomy Care, Replacing Tracheostomy Ties. If that is not necessary, take the split gauze from the sterile field. Tell the patient that you will need to press lightly on their neck and then gently slide one side of the gauze under the trach tie and move it underneath the flange. Do the same on the opposite side. Ensure the gauze is under the flange. The split should always be directed up, under the patient's chin. Tighten the trach collar and replace it over the tracheostomy tube. Document your intervention in Epic. Also be sure to inform the respiratory therapist that the inner cannula has already been changed for the shift. If you used any of the required bedside supplies, be sure to replace them as soon as possible. Cleaning the inner cannula can be completed by either the registered nurse or the respiratory therapist, and should be completed at least once per shift. The timely completion of tracheostomy care is vital to ensure the health and safety of our patients.